focus on your health today, in particular women's breast health. And ladies, we all know that at a certain age we should get yearly mammograms. It's one of the first steps in detecting breast cancer. It's not only important to get the exam, it's important to know who's reading the results. And today I'm joined by Dr. Lauren Miller, a fellowship-trained breast imaging specialist for Riverside Radiology and Interventional Associates. Dr. Miller, nice to have you here.
Hi, thanks for having me. I'm glad to be here.
I want to know what it means fellowship-trained, because I know that's a step up and you take a lot of extra schooling for that. So what does that mean for our viewers?
Sure. Thanks for asking and clarifying. So I went through 4 years of medical school, followed by 5 years of diagnostic radiology residency, and then I followed that up by 1 year of specialized fellowship training in breast imaging. So I read all kind of x-rays, MRIs, CAT scans, ultrasounds, but I specialize in breast imaging. So mammograms, ultrasounds, breast MRIs, and breast biopsy procedures.
And so what's the benefit to the patient to have someone like you who just is experienced in that reading their results?
Well, you know, in today's day and age when medicine is becoming more specialized, more specific, more detailed, and patients want accurate reports, it helps to have more experience and more subspecialized training in a particular field and reading particular studies to help give prompt and accurate diagnosis.
Can you see things you think that others might miss?
I think that it definitely helps. The more experience and the more subspecialized training, you know, when to call something abnormal, when to call something normal. As we know, both normal and abnormal things can be anxiety-provoking and lead to additional things for the patient. So we want to make sure that the reports are accurate.
Now, not just the reporting and looking at the results, there's also new kinds of equipment that you're using for breast imaging. So it's really becoming high-tech.
Yeah, it really is, and that's what's been so exciting about the breast imaging field over the last 5 or 10 years. We have multiple new modalities that are really helping us detect breast cancer early and accurately. Such things like digital mammography, it's really become a mainstay in the field and is really the standard of care. Now, breast MRI has really improved, especially in situations where women have known breast cancers and we need to evaluate how extensive the breast cancer is, or in women who have a high risk, a strong family history for breast cancer or a personal history of breast cancer, and we need to screen them by using breast MRI. We can even do biopsies using breast MRI. Ultrasound has gotten higher resolution. There's a technique called elastography. And additionally, mammography has progressed into a 3D technique called tomosynthesis, where we can detect certain things even better additionally, which can be a really helpful asset in evaluating not just a standard mammogram, but adding this 3D mammogram.
So you've mentioned so many different things, from MRI to the new 3D imaging. How does the patient know what to even ask for? Or do you rely on your physician to say, you know my history, family history as well as my own, what do I need?
We kind of work with the physicians and the patients. We look at their breast density, we look at what kind of abnormality it is, if it's a mass, if it's calcifications, if it's an area of distortion, and we look at all the things together and provide the best recommendation for the imaging, whether it's a combination of ultrasound, mammogram, 3D mammogram, and MRI. They really work hand in hand, and each patient is an individual patient overall.
There are so many tools available now that I think women should feel empowered by the fact that not only are the tools available, but people like you who are reading them, as you say, there's not those false positives or things that might scare people.
Yeah, I think that, you know, we understand that breast imaging and breast health and breast cancer overall is a very anxiety-provoking situation. Women are very nervous when they're coming to get their mammograms, and we want to provide the best care, the most accurate care, and, you know, we've got a lot of tools at our hands right now to help women.
It doesn't hurt to talk about the basics again as far as what women should be doing on their own to guard against breast cancer. So what should some of those be, Doctor?
Yeah, sure. That's a great question, and I've brought a few tips here I'd like to share with the viewers today. So number one, get your annual screening mammogram.
At what age?
At what age? 40. We recommend, there was some controversy a couple years ago,
right,
but many of the major organizations, including the American College of Radiology, we recommend starting annual screening mammography at age 40 and continuing every year. Now, if you have a strong family history, you may need to start screening before that, but most women start screening at 40 and get it every year.
Okay.
So number two, perform regular self-breast exams and let your doctor know promptly if you feel a lump or have any new symptoms like dimpling or skin changes. Report those to your doctor promptly and get to know your breast by your own self-exam so you know when changes occur.
Mm-hmm.
Number three, learn about your own family history of breast cancer and find find out about your own personal risk for breast cancer. That could help lead to whether or not you should get additional screening with
all those things we were talking
exactly,
about. All those
MRIs,
other tools, right?
Exactly. And then finally, number 4, maintain a healthy lifestyle and diet. Some studies have shown that you can decrease your risk of breast cancer if you just lead a healthy life, watch your weight, watch what you're eating, overall live a
and that's good for everything. Heart disease, diabetes, all those things. It doesn't hurt to eat healthy and just take a walk every once in a while.
Exactly.
Dr. Miller, thank you so much for being with us.
Well, thanks
Great
for having
information.
me.
Thanks.
Yes. All right.